Good afternoon, my name is Michaela Etheridge and this is going to be my trach care recheck. So I'm doing care, so I have already done the suctioning procedure and I have already auscultated after the suctioning procedure to compare. I've already removed my sterile gloves and placed on clean gloves, so now I can begin. So the first thing I'm going to do is open up my care kit. I'm going to remove the sterile field, only touching the 1-inch border. And I'm going to lay the shiny side down. I'm going to dump the contents of my kit onto the sterile field. I'm going to remove this plastic container and put it next to the sterile kit. And normally I would need my bedside table to be higher than my waist so I won't break sterility, but this is the only area I have right now, so this is what I'm using. But I am breaking sterility by doing this. I'm going to get my saline. I'm going to palm the label, and I've already checked the expiration date, so I'm going to open up the top and I'm going to pour into my container. I'm going to replace the top and put the normal saline aside. And I'm going to remove my patient's O2 therapy. I'm going to secure the faceplate, and I'm going to remove the inner cannula and the drainage sponge, and I'm going to replace the O2 therapy. Then I'm going to place that into the first container. I'm going to take off my clean gloves. I'm going to perform hand hygiene. And I'm going to don my sterile gloves. I'm going to open up my package. I'm going to put on my dominant hand first. So I'm putting it on up and away from my body. Then I'm going to do my non-dominant hand. And then fix my fingers. So now I can begin. So I'm going to separate my supplies onto my sterile field without making sure they don't touch the 1-inch border. And I'm going to remove the inner cannula from the first container. And I'm going to clean it, making sure not to splash on the sterile field. So I'm going to clean the outside. And I'm going to clean the inner lumen. And then I'm going to throw that away with my hands above my waist. And I'm going to place it into the second container. Then I'm going to, after I'm rinsing it in the second container, I'm going to remove it. And I'm going to dry it off with a dry, sterile gauze, making sure not to dry over my sterile field. I'm going to throw that away. And then I'm going to dry the inside with my pipe cleaners. Still making sure not to dry over my sterile field. I'm going to throw those away. And then I'm going to replace the inner cannula. So I'm going to remove my patient's O2 therapy. I'm going to make sure to secure the faceplate, insert it from a 9 o'clock to a 6 o'clock position, and make sure that it's locked in with the locking mechanism. And then I'm going to get my cotton swabs and put into the third container. And I'm going to clean from the stoma to the surrounding 2 to 4 inches going from closest to the stoma out. I'm going to throw that away. I'm going to do it again on the bottom of the stoma. The same thing from the stoma out 2 to 4 inches. And throw it away. And I'm going to clean the faceplate and the outer cannula with a moist gauze. So I'm going to clean the outer cannula and the faceplate. And throw that away. And then I'm going to pat it dry with a sterile gauze. And then I'm going to replace my trach ties. So to replace my trach ties, I'm not going to remove the old one until I have the new one secured. So I'm going to place it in the faceplate and secure it around the patient's neck. So my trach tie is not long enough really to do a double knot around the box, but I would make sure that one side was longer than the other, and I would do a double knot, and I would either leave it loose or I would make sure I could fit 2 fingers underneath so that there is no, it is not squishing the carotid area. I'm going to make sure to stay away from the carotid area. And then I'm going to remove my old trach tie. I'm going to throw it away. And while I was cleaning, while I was moving the trach ties and all of that, I would check for any skin breakdown. So I would check for any arrhythmia, blistering, drainage, or any discolorations under the faceplate, around the stoma, or underneath the trach ties. So now that I'm done with that, I'm going to replace the drainage sponge. I'm going to remove my sterile gloves, so glove to glove and skin to skin. I'm going to perform hand hygiene, and I'm going to put on clean gloves. Put it on my wrong hand. I'm then going to auscultate my patient's chest and do a respiratory assessment. And I would assess before and after trach care. I'm going to perform oral hygiene with a toothbrush or an oral swab and chlorhexidine rinse. I'm going to remove the drape from my patient. I'm going to place the bed back into the lowest position with the side rails up, making sure the patient's comfortable and making sure that the head of the bed is no lower than 30 degrees. So I'm going to have my patient and I have the bed. Then I'm going to remove my gloves. So I'm taking off my PPE right now. So I'm taking off my gloves. I'm taking off my goggles. And then I'll take off my gown, making sure to only touch the inside in case there were secretions, and then take off my mask. I would go and perform hand hygiene, and I would document. So for documenting trach suctioning, I would document that I did the procedure. I would document the characteristics of the secretions, how the patient tolerated the procedure, and I would document the respiratory assessment. And for trach care, I would document that I completed that, and I would document the size and type of the tube, and I would document the of the catheter of the trach tube, and then I would document the appearance of the stoma and the surrounding skin.